The U.S. healthcare system is on an unsustainable course with rising costs, declining service levels, and fraying relationships between provider systems and their clinicians. Value-based care is sometimes held out as the cure-all. So, is it a panacea? Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Emily Young, president of Tufts Medicine Integrated Network, and Courtney Fortner, CEO and president of Navvis. They're partnering on value-based care. Welcome, Emily, and welcome, Courtney.
Thank you.
Emily, why is Tufts making a big bet on value-based care?
Tufts is making a big bet on value-based care because it believes the healthcare system is very broken. We have to focus on affordability, experience. We have to change the current state, and we don't need incremental change, but we need transformation. We continue to poke at the edges and make things better incrementally, but we really need to do something much more to address those problems that are plaguing the healthcare industry.
Courtney, does that make sense to you?
Yeah, absolutely. It's getting at the root cause issues. It's addressing the things that we talk about all the time: quality, access, affordability, and experience. And that experience is both for the patient and the provider.
I think it also provides the economic engine of transformation and creates a platform for us to work together. We often talk about volume and value. We need to bring that together. We need to collaborate, not pit each other against each other, and come together to think about how we as a health system create an ecosystem to address these problems.
So why did Tufts decide to bring in a partner for value-based care rather than going it alone?
Yeah, great question, because we have been doing this. We've been in value-based care and we've done well in value-based care. But when we took a step back and assessed our capabilities, we felt that our path would be much better served if we could accelerate it. And that required finding a partner who could help accelerate that journey and bring new capabilities that we didn't have. The scale also, from a population health perspective, to be able to take the costs and learn from the experience of millions of lives versus our 100,000 lives, that we thought there was great value in that.
And Courtney, does that line up with what you see with other clients?
Absolutely. It is, a lot of folks are on this journey, but they're looking at how do they accelerate, how do they scale? And the factors in choosing a partner are really about cost and speed and just overall what they believe the impact will be.
And we looked for a partner where we felt there was cultural alignment. So I think that was something that was very important to our partnership, making sure that what we believe in, the true transformation of healthcare that needs to happen, and the role that physicians play in that transformation is something that was very important to Tufts Medicine. And we were happy to find a partner that also valued the same things.
And I would also just say that the word partner is really important to us because we're in an operating partnership. So not a vendor relationship, truly an operating partnership where we're in it with our partner.
Courtney, I hear about health systems talking about jumping into value-based care. Is it something that they can decide, or is it more determined by what the payers and the government are doing?
Yeah, great question. I would say everyone's kind of at a different starting point. So when we talk about value-based care, are we talking about risk or purely upside? And risk may not be day one, but what's important is mapping out the journey. And that journey is dependent on both the system and the payer. And what's important is, do we have a strong payer strategy as part of the capabilities we're bringing to bear? Payers want you to take risk. In fact, I think many health plans have commitments to their boards. So while the actual negotiation of a certain contract is by and large on the payer, we've got to show them that we can take risk. And that pace is determined by the system. So in our experience, really, in standing up capabilities and infrastructure in that ecosystem that we referred to, is we show the payers that they're more than willing. What we have to be cognizant of is the pacing and sequencing in conjunction with one another. Because if we're, start performing at a 75% MLR, what's the incentive there for the payer to negotiate a contract? So core to that is establishing the right relationships. And again, having a very strong payer strategy. It's not just about negotiating the contract. It's really, again, we keep referring to this as the ecosystem, putting all the pieces in place and then having the right relationships and working together versus creating that polarizing divide of provider versus payer.
Yeah, I agree. I think payer partnerships are critical to being successful with value-based care. And I think that we have tremendous opportunity to influence our commercial payers as to the terms that we want to operate under. And that's an opportunity for us to influence that. Obviously, we don't have that same influence with the government payers. We certainly do with Medicaid, within the state. Less control with CMS, but certainly have a lot of ability to execute and perform well and choose which CMS products we participate in.
Great. Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Courtney and Emily. Emily Young, president of Tufts Medicine Integrated Network, and Courtney Fortner, CEO of Navvis. Thanks so much for joining me today on HealthBiz Briefs.